Bob, can you tell us about this board that you sit on? What is it, and what is its primary purpose and role for Washingtonians, I guess?
Yeah, so the Washington State Board of Health, we are a 10-member board, one member of whom is the Secretary of Health, Dr. John Weisman. We are all appointed by the governor, and essentially what we're there to do is what's called rulemaking. So there are certain responsibilities that the board has, and there are rules which we are asked to perform. And so in the case of this particular executive order that was proclaimed by Governor Inslee 2 weeks ago, that's under our responsibility to actually make the rulemaking for that executive order.
Rule making or
Rulemaking, yes.
Okay.
Rule, R-U-L-E,
Gotcha.
rulemaking, yeah.
Okay. Can you give us some examples of other things that the board has taken up in the past?
Certainly. So for example, with respect to vaccinations, so we're responsible for the determination of what are called the WACs and the RCWs. That's the actual rules, that the statutory responsibilities that local health departments do. So around vaccinations. There will be rulemaking that will occur around domestic animals. A lot of issues around sanitation, for example. So that's all under our responsibility.
Gotcha. And talk about who the board is made up of. We're talking doctors, you said dentists, all fields, right?
So essentially what they do is the board is made up of individuals who represent different sectors. So there are consumers of health. There are individuals such as myself who represent the health officers across the state. There are members who have expertise in public health and sanitation. There is someone representing the tribes. There's someone representing government. And then, as I said, Secretary Weisman, who is the Secretary of Health for Washington State.
How long have you been on the board? And actually, can I borrow, I'm going to use my cell phones actually. I'm going to angle this up just in case. I'd hate to do this interview and have the audio be bad. Okay, can you tell us how long have you been on the board and how you were appointed by the governor to be on the board?
I was appointed last year in 2018, and essentially there was an opening, and specifically to be the spokesperson for health officers across the state. And within the group of health officers, we looked for people who were interested. I expressed an interest. I was nominated by the health officers to represent them, and that's why I'm there.
Great. So tell us about this executive order that the governor introduced 2 weeks ago. You touched on it briefly just a second ago, but can you explain why this Board of Health takes up such an order like that?
Yeah, so again, as part of its responsibility, when and if the governor were to declare an emergency proclamation, an emergency order, that comes under our purview, and we work on the language to actually put that into effect. So Governor Inslee's executive order that would eliminate the sale and purchase of flavored vaping products came as a response to the vaping injury that has been identified over the last few weeks across the country, of which we are now seeing over 1,000 individuals in almost every state having been identified as having injuries due to vaping. And within Washington State, 7 individuals currently that we've identified, and a number of other individuals who are currently under investigation for having met the criteria from the CDC.
Can you tell us what was the purpose of the meeting yesterday? Was it a regularly scheduled meeting, or was this a meeting called specifically because of this agenda item?
No, the former. So this was a regularly scheduled board meeting, but the agenda was modified because of the fact that as part of our responsibility, when an executive order is called, then we have to meet in a timely fashion. And so it just happened to be very convenient that we had a regularly assigned meeting. The agenda was just sort of augmented to allow us to do the rulemaking.
How many meetings a year do you guys have?
About 8.
8 a year. Okay. Tell us what how did the conversation start yesterday? What was introduced? I'm assuming the executive order. And just kind of walk us through what happened yesterday. Sure. From what you heard.
Sure. Well, first of all, there was a significant amount of public testimony. once the executive order was issued a few weeks ago, the Board of Health received an overwhelming amount of public testimony, written public testimony. More than 2,000 emails were sent in, again, with issues and concerns around the executive order. During yesterday's testimony, a significant number of individuals were given time to actually provide oral testimony to their concerns. There was also testimony given by a number of organizations, such as the Washington State Medical Association, the Washington State Nursing Association, an organization that represents public health officials. They all gave either written or oral testimony yesterday, again, presenting their concerns or their support for the board in determining whether or not to enact the executive order.
But you were telling me it primarily was not support, it was those who wanted to speak out against the order, right?
Correct. I would say 90+% of the individuals who were in the audience yesterday were again speaking out against enactment of the ordinance.
We've heard some of their argument. Based off what you heard yesterday in the public testimony, what did they have to say about why they didn't favor this order?
Well, I think their arguments were based upon a couple of different lines. By far and away, the one we heard the most was how it would impact small businesses. Secondly, there was a concern that vaping products have been around for quite some time, and the number of injuries, the number of individuals who have succumbed and had problems with vaping are few and far as compared to the number of people who are using vaping either as a substitute for tobacco or in conjunction with tobacco. And those tended to be the primary arguments. Some people were saying that they had anecdotally been able to quit their use of tobacco products as a result of vaping, and by eliminating vaping, specifically the vapor products that are flavored, they were concerned that they would end up falling back to use combustible products.
It's a very complex issue. Obviously, I think that's safe to say. Anyone would agree that's very complex. But can you give us what was the vibe in the room based off what you could hear? Was it very tense? I mean, can you give us an idea for those who weren't able to be there? What was it like?
It was, to start off, I think it was very, very appropriate. I mean, it was a give and take. And I think as board members, we certainly understand and appreciate that there's going to be diversity of concerns and diversity of opinions and beliefs. It became somewhat more heated as the testimony unfolded throughout the morning, to the point of becoming very aggressive over the break. And then during the actual discussion of the executive order itself, there were a number of public outbursts, which were unfortunate because it then did sort of lend itself to maybe questioning, maybe allowing yourself to be a little bit impacted by the negativity of these outbursts. I think, we certainly look upon the issues objectively. We also look at the data, and we also know how it may impact individuals. I think the priority for us is and always will be how it impacts the health of the individual and the public, and that has to be our responsibility.
So in the public comment kind of portion throughout the day, does the board respond to questions or answer, or is it just public comment?
Just public comment.
Gotcha. Was there anything that stood out to you, either for or against yesterday, that, I don't know, kind of was a light bulb moment for you, something you haven't heard of before, or something that surprised you?
Not much. I mean, honestly, I think we heard a lot of information concerning how it will impact businesses. I think there's also misrepresentation by retailers indicating that the vaping products are quote-unquote regulated. I think that's a misstatement. We know that the ingredients themselves are regulated. They're regulated for ingestion, not for vaporization. And so what they are doing is taking a regulated substance and then combining these regulated substances for ingestion and using that to say that they are regulated. They're not regulated for vaporization, for any kind of aerosol use. And so again, I think that's misrepresentation, and unfortunately people then will misunderstand that, oh, I'm using a regulated product. Why is the government that regulates these products now not allowing me to use them? So I think, again, that's for me one of the concerns, because again, I think the public doesn't always see that. More importantly, this particular ordinance, this particular executive order is really focusing on kids. That's the reality. I mean, youth are significantly impacted by using vape products. A number that stands out for me is that less than about 3% of adults in a nationwide survey report to using vape products. 21% of high school students regularly use vapor products. And a significant percentage of those individuals do not realize, of those teenagers do not realize that there is nicotine in those products. So I've got a sevenfold difference between the youth that are using nicotine-containing products and adults who are using it. The vast majority of youth are not using it to eliminate tobacco usage, because the vast majority of kids don't smoke cigarettes. They've been using vapor products, but we know nicotine is an incredibly addictive substance. And this, unfortunately, is creating a new generation of nicotine addicts.
Can you give us a rundown of the highlights of the executive order? What's in it, and I guess what are the main changes starting today?
Well, effective today, any retail shop of both vapor products that are containing nicotine and or those that also provide THC. Vapor products that are flavored are not going to be allowed to be sold for 120 days. And then all retailers must provide signage, re-edit this. All retailers must put signage in a very visible place. The signage is coming out from the Department of Health, and it essentially says that vapor products are not safe, and they are strongly encouraged to not use vapor products going forward.
And that's pretty much it for 120 days?
120 days.
What's the purpose of 120 days? What is there going to be, like, are we just waiting to learn more about vaping products? What is the purpose of 120 days?
Essentially, when executive orders such as this are written, that's the tenure of the executive order. It could be extended, it could also be shortened. That's just sort of a standard amount of time. If you look at other states that are doing similar types of enactments, it's for a similar period of time. In some states it's 6 months, in some states it's 4 months, and that's where we are.
And then you and I talked about this before we started the interview, but could you just address people who say that this will push more people to the black market? Can you talk a little bit about that? Because you were telling me that the majority, if not all of the people who are reported sick, they didn't get it from the black market. Is that correct?
We don't know.
Oh, okay.
I mean, yeah, unfortunately, we really don't know. Certainly a number of individuals do report black market use. We know in Washington State, at least a couple of individuals state that they bought their products directly in shops. I think one of the challenges we have is that we still, to this day, do not know exactly what the causative agent is and or where it's being obtained. I mean, this would probably be a lot simpler if we knew that it was product X that was obtained in this means and or this device that was causing the problem. Rather, that there's been a huge diversity of both products and devices that are being implemented, I should say being implicated. So we know that whereas close to 80% of individuals are saying that they used a THC containing product, a smaller percentage of those individuals are only using THC. Similarly, we know that more than 50% of individuals state to be using a nicotine containing product, but nicotine only, a smaller percentage. So what we're seeing is that individuals are using vaping products and they may be using THC, THC in conjunction with nicotine, nicotine in conjunction with something else. We don't know. And so until we know, we are going to take a very sort of preventive, cautionary approach. And until we know, we're going to recommend that vaping products not be used. We know that flavored vaping products are disproportionately used by children, by youth, and by adults. 98+% of the market is flavored product. Huge. So all the research shows that youth tend to use flavored vaping products. They don't like the taste of nicotine-based products, and so the flavors make them more conducive to use. And so this is a means by which we see a way to really lessen the use of vapor products by youth.
So these stores, they can still sell plain flavored vape, right, I'm assuming?
Right.
Okay.
Plain flavored, plain, menthol, those are still, but anything that is tutti frutti, bubble gum, those flavors are all going to be banned effective today.
Wow. So they're going to have to clear off their shelves today.
Correct.
So who enforces that? I mean, I'm assuming they get checks by some agency
So
eventually?
so enforcement is going to come from a variety of different means, whether it's Liquor and Control Board, whether it's local health jurisdictions. We're going to hope and believe that retailers want to do the right thing, because again, they do not want to be providing an unsafe product to their consumers. But enforcement is going to take place by a variety of different means.
Can you tell us about the vote? How did the vote come down? I know it was unanimous, but was there any discussion before you guys took the vote? Tell us about all of that, what led up to the vote.
No, I think there was robust discussion. I think that all of us at various levels were moved by the testimony. It's very telling when you have somebody who states that they have a significant illness as a function of tobacco, and in light of being able to use vaping products, they no longer are using combustible products, and they find that their symptoms have lessened. I mean, that's a very telling story. I think that all of us are also very concerned about the business aspects. We understand that for many individuals, for many small businesses, this is their source of revenue. And to enact this legislation is going to impact them. As a result of that, I think, this was not a black and white decision. But again, as I mentioned earlier, our first and foremost responsibility is to ensure the health of the individual and the health of the community. The evidence is overwhelming that vapor products, especially flavored vapor products, are disproportionately being used by young people. We know that young people are very susceptible to the effects of nicotine, and if we can eliminate their usage of nicotine-containing products, then we're going to be very supportive of that. And in conjunction with that, we have this injury that happens to be occurring at the same time, which gives us even more reason to enact such an ordinance. So after a lot of deliberation and discussion, again, robust conversation, unfortunately at times having individuals from the audience interject their concerns while we're verbalizing our conversation. As you mentioned, it was a unanimous vote.
So that vote doesn't happen in private, it was like in...
It's public.
Wow.
Yeah. Yeah.
Imagine that got very intense. Yeah, I think that's all the questions I have. Is there anything else that you want to add? We covered a lot.
Yeah, there's a lot, yeah, so cut it down to 1 minute there. Yeah, I mean, I think this represents a unique opportunity for us in public health to weigh in and be proactive at some level in preventing youth from becoming addicted to nicotine-containing products. I think that when you look at the research and when you understand how youth are impacted by flavored products, and again, the research suggests that they would not consider continued usage of vaping products if it weren't for the flavors. They don't equate the flavors with anything harmful. They sort of see it, it's enjoyable, and therefore it's not bad for you. If we're able to, in a proactive fashion, prevent youth from turning to tobacco and or nicotine-containing products, which we know as tobacco is the leading cause of preventable death and illness in our country, then we're doing the right thing by public health.
So, anything else you should talk about?
Oh.
You covered a lot.
Yeah, with the main points were, getting the point across that we don't know why this is
Right.
happening, that it's not just
Yeah.
products that haven't been bought in stores, and that's, I think,
Yeah.
the
Yeah, and I can-
misinformation that is out there.
Yeah, and let me just.
And also the nicotine issue of that people don't realize nicotine is in these products.
Yeah.
So I think those are the key.
Yeah, I would say that again, yeah, it's just sort of to reiterate, I think that, yes, an unintended consequence may be that people turn to the black market. The reality is, however, that we can control what we can control. And unintended consequence, but if we're able to lessen the use and availability and access of vaping products, flavored vaping products for the majority of individuals, especially youth, then we're doing the right thing. I think also what we realize is that many youth do not realize that vaping products contain nicotine. They find it to be a pleasurable, enjoyable activity that they're doing in a social context. Unbeknownst to them, they're getting themselves addicted to nicotine. And so this also gives us a means by which we can address that. And then finally, we do not know what's actually causing the injury. And until we do know, we're going to take a very precautionary approach. And this is the best and most complete way that we can actually prevent further injury.